My great pleasure to introduce Amos Ziv. I first met Amos in a research context, but he does everything. He's a classical acupuncturist and herbalist. He's also an innovator, an entrepreneur, an integrator, and a researcher. And today he's going to be talking about classical channel theory. Tomorrow he's going to focus on cardiovascular stuff, arrhythmia. And it looks like you're going to get a practical demo of some sort. So please welcome Amos Ziv.
So good morning, everybody. You're hearing me right. So first of all, thanks for coming. It's an honor and a pleasure to present a lecture there at the BXC. I want to thank both Mark and Kevin for having me here. The second time, actually. So I'll briefly introduce myself and what I do, and then we'll jump straight into the stuff. I think fascinating stuff. So, my background is mixed. I started with sciences, biology, life sciences, and then moved to Chinese medicine in the United States, actually in California, in San Francisco, in 1996. And apart from studying herbal medicine in a school in San Francisco, I was very privileged to meet Professor Wang Yi, who you may have heard of, and who just classical contemporary master of Chinese medicine, who just recently, about a month ago, passed away. So this is a lecture dedicated to him and in his memory. And a lot of the works, especially the theory that we discuss in this class, not so much the practical stuff, but more the theory on which the practical stuff is based, is based on Dr. Wang's teachings and theories and discoveries. So I work in Rehovot. It's a town just 25 minutes south of Tel Aviv in Israel, and we have a big acupuncture clinic there. But I also do a lot of integrated work with physicians. I used to work in a hospital in Israel, Safo Family Hospital, where we actually founded. I was running our research unit where we did research on different modalities of integrative therapies, not just Chinese medicine, but others as well. But of course, my focus was on Chinese medicine, and we did some interesting research. Some of it I'll share with you today. Now, the purpose of this class is to expose you to this material, but also to be able to practice it, or at least demonstrate and also practice. I brought some stuff for you guys to practice. So maybe we can do some like a hands-on practice towards the end of the first part. Actually, no, we're going to do it at the beginning of the second part of the class. We'll do a demo in the first part. So the idea is that you can get at least some part of, or a tool that you can use in the clinic, because some of these things are really profound. And my motto always is to make meticulous record keeping in terms of your work with patients, because I think record keeping is the key to understanding how successful you really are in clinic. And I think one of the things that I focus with this system is the idea of quantifying the limitation and making sure that you're making progress, first of all, during the treatment, but also during the treatment series, and quantifying the limitation and recording your progress, I think, is key to that. So, I also co-chair a nonprofit Israeli-Chinese organization where we actually promote academic studies and research with China, mainly with Shanghai University of Chinese Medicine, but also in Beijing. And an Israeli startup company that actually deals with integrative technologies based actually on initially based on Chinese medical principles, actually. I'll talk about that tomorrow in the cardiology class. So you're all invited. So what will we cover in this class? So we'll talk about the foundations of channel theory and how channel theory is one of the 3 pillars of Chinese medicine. And we'll talk about the 6 Qi and the 6 climates, or the 6 evil invading climates, but also more importantly, the physiology of the 6 climates. We'll talk about the concept of the body actually being set up with 6 primary paired channels rather than with 12 primary channels. And we'll talk about the energetical resonance of each of these channels and how you can apply this understanding in your clinic. We'll talk about the differences between substance, matter, and energy, qi, and how important it is to move substance when you have stagnation of substance, which in most cases of chronic pain there always is. And we'll talk about how to remove this stagnancy. We'll talk about the advantages of distal needling and leveraging channel qi to get an immediate effect in terms of your effect on pain management and limitation. And we'll do some clinical examples and hopefully both a demo and a practice. So, how many of you have been practicing acupuncture for at least 2 years? Wonderful. Okay. How many? More than 10 years? So a lot. Okay. So normally, some of these concepts that I talk about are more difficult to apply because I talk a lot about distal needling and almost not at all about local needling, at least not at the early stages of your treatment series. And if you're very much used to doing local needling, you'll need to exercise some flexible thought. Okay. So keep an open mind. It's not going to contradict anything that you're doing. Normally, I teach this system as an add-on therapy to whatever you're doing in terms of both, it can be acupuncture or tuina or physiotherapy or shiatsu or anything else. But you will need to keep an open mind. So let's talk about the 3 pillars of Chinese medicine. And these are the yin-yang 5-element theory on one hand, which are general concepts and theories which describe not just Chinese medicine, but the whole Chinese view, philosophical view of the universe on one side. And in Chinese medicine specifically, we have the Zhang-Fu theory, the 5-element theory, the Zhang-Fu and the 5-element theory, which actually discuss the workings of the body. Now, this is pretty much emphasized a lot in school and study, but the theory that binds these 2 theories together, or channel theory, meridian theory, in most school curricula, for different phenomenal reasons, is not emphasized a lot. At least it wasn't used to. I think it's a little bit better in recently, but in the past when I was studying it, we were talking about yin-yang, 5 elements, Zhang-Fu theory, not so much about channel theory and its applications. And this is really important because this connection between the outer world and the environment and the rules of the universe on the one side and the inner world environment and the rules of the inner world, this connection is actually conveyed by the channel theory. Okay, so you have to understand how important this is to the physiology, pathology, and treatment. Let's talk about yin and yang and the 5 elements. So, yeah, yin and yang it's a philosophy. It's a basic code that actually describes the workings of the universe. In the Chinese classics, in the books, it's discussed as the language that describes the way things work. Okay. And Chinese medicine is based on the teachings or the workings or the thought principles of the Tao, the Taoist. And now, since I don't have I'm going to try this trick here because I want to write some stuff, and so I'm just going to do this and see if this works. Hold on. Okay. Let me try this. So, Lao Tzu in the Book of Tao talks about how things were out of order and then order became. And order became by the split or by the separation to two oppositioning poles, which he termed heaven and earth. Okay? So heaven and earth, you'll have to excuse me. Okay. Are most yang and yin. So these are the most fundamental principles of duality that actually allow the potential of everything else to grow. Okay? Because if you think of our world, okay, we have the skies above, okay, and we have earth below, and we have rain going down, and we have plants growing up here, and all of this together allows the creation of life or nature. Okay, so this trilogy of heaven, man, and earth, okay, is conveyed by this oppositioning poles of potential, or potential oppositioning poles. Because you have this potential difference between heaven and earth, okay, you have the ability of things to grow from the earth, okay? And mind you, this is circular because water from the oceans go back up to the skies and vice versa, and then we have rain coming down. And this constant change of yin and yang allows man, which is all natural phenomena of life. Okay. So it's really important to to understand that this duality, almost like in a battery, okay, the potential of things to arise from this duality of a plus and a minus, like heaven and earth, this is the way everything works. Okay, I call this the mathematical code behind natural phenomena in life, because in math, all equations in physics and all other scientific fields like chemistry and so on, they're all based on mathematical equations. Okay, so this is like the math code from a Western parallel. On the other hand, in Chinese medicine, we have the Zhang Fu theory. Okay, this is the subject of discussion. So we have the language that describes things, but the subject of discussion was the internal organs. And the internal organs create and preserve vital substances, which are qi, blood, body fluids, and also preserve jing and the essence. Okay? And this creation is based on interactions. And these interactions are interactions that happen inside the body, but also interactions that the body has with the outer universe. Okay? So, and again, we'll dive deeper into that in a second. I call this the biological code of the processes in the body, because biology, okay, which is the basis of physiology and anatomy and physiology, okay, is what makes the body work. Now, in between these two theories, pillars of Chinese medicine, remember these are 3 pillars, okay, we have channel theory. Now, the interesting fact about channels is that they're not just hollow pipes. This is a live network that binds the extremes, the yin and the yang, the external to internal, okay? In fact, the classics describe the channels as an integral part of the organs, almost like an extension of the organs. And you'll see in a minute that this is really broken down to a realistic fact in terms of diagnostics and therapy. So the channels are physiologically active. They're not just there for things to pass through. Okay? They have a role in regulating physiology. And by this ability to connect everything, all aspects of the body, and by this ability to connect the body to the outer environment, this actually creates the basis of holistic medicine in Chinese medicine and Chinese thought. Now, I call this the physics and chemistry, the physical and chemistry codes of the laws of the body, because on physics and on chemistry, we have biochemistry, and we have thermodynamics, which is everything that regulates the functions of the organs in terms of allowing the biology to manifest as anatomy, physiology, and pathology, and so on. So the channels actually operate as a network, and this network has two distinct traits, okay? On the one hand, it's a pathway, like we've learned. It's a pathway for delivering qi, for delivering blood, for moving of substances, okay? But it's also a network of information which constantly checks the inner environment of every organ. Since every channel is connected to two organs, okay, the balance of the environmental balance of these organs are actually checked by the channels. Let me give you an example, okay? So just before starting this class, I went outside and I was sitting for like 15 minutes kind of to relax before I get all excited to come up here. And I think the temperature outside is what right now? In Celsius, it's, I don't know, 20, 22, less, 18? Okay, maybe 18. Okay, 18? All right, I come from very hot weather. So, and then the temperature in this room would be 25, 20? I'm missing off, right? Tell me, I'm trying to, what would you say the temperature in this room is? Outside is 16, and in here it would be 20. And our body needs what? To operate, what temperature? We need to keep 37, right? Around 37 to keep. So this difference between 16 and 20, how does the body maintain this constant equilibrium of temperature, for example? This is just one example, okay? So something needs to sense the fact that I'm out there and it's cold, and I either need to bring more heat to the surface to counteract that cold, or I need to somehow shut down cold from entering the inside. And then when I'm in this room, something needs to sense that I'm actually, it's hotter, and I can release that. I can send less heat to the periphery, and maybe if I'm really getting hot, maybe open the pores and sweat a little bit. So all this information is gathered constantly by the channels. Okay, from a Chinese perspective, this is what the channels do. They check and they respond, and they command the inner environment to react accordingly. Okay, this is really important. It's the most fundamental aspect of physiology, and this crosses almost every. We'll talk about different channels and what they do, but this crosses all the different Western analysis systems. So you can't say the channels are neurological, or they're not endocrine, or they're not cardiovascular. They actually crisscross those, okay? So this information is constantly checked. Now this goes for internal processes as well. If I was to eat a big meal, a huge meal right now, something would need to convey this information to the spleen. Okay, you get ready. We have a lot of nutrition coming in. It could be good, could be bad, but it's coming in. So you need to start preparing for that. And actually, this starts when we look at food. As soon as we look at food, we have the digestive system actually starts. So the channels are openings to the outer world, which actually connect to the inner world. So and then the senses. So the 6 qi, or the 6 environmental climates, and I think I've been teaching these theories for a while. Let's say more than 10 at least 10 years here in Europe, but in Israel even more. And when I used to ask these questions, what are the 6 qi? The answer I used to get was the 6 evil climates. Okay, nowadays I think this is different. They actually teach the 6 qi as 6 climates of physiology before they are pathology. So this is a good change. So they're not just evil. They're not evil. I mean, and the 6 qi are wind, cold, heat, dampness, fire. Okay, These are not evil entities. These are climates, okay? These are, okay, no. Lost that. These are climates. These are necessary climates for the workings of the body. And we know that from a Chinese medicine perspective. You all know that. This one also. We all know that the 6G are basically 6 foundational climates of the outer world that also apply in the inner world. And you know this instinctively, and you use this in the clinic instinctively. Let's talk about, for example, the Tai-Yin system. Right? Tai-Yin system involves which 2 organs? Can you tell me? Spleen and lung. What's the environment or the climate that has to do with Tai-Yin function? Dampness. So when you think of dampness, what do you think of? Do you think of pathology normally? I'd bet most of us initially do. When we think of dampness, we think of pathology. Okay? But before pathology, there's physiology. Okay? So what's the functions of the spleen and the lung together as a system? It's a system that actually is supposed to create vital energy and chi for daily life activities. And we do that from gathering air by breath and food from the stomach to the spleen. Okay? So what's dampness? What does dampness have to do with this? So this energy that comes from air and food eventually needs to reach, are you familiar with the term end user? So what's the end user of this energy in our body? From a Western perspective, let's say. The cells. Yeah? So how does this energy from digested or ingested food and air get to the cells? Okay. So something needs to transfer this energy to the cells. We know now that the blood actually transfers these nutrients, right? And then from the blood, it goes to the extracellular matrix from a Western perspective, and then it goes into the cell. But you have to understand and realize and agree that in order for that to from my mouth and from this breath to travel through the digestive system to the blood, and from the blood to the cells, it has to be in liquid form, some kind of liquid form. Okay? Because blood is liquid. What can we do? Okay? So there's a name for that in Chinese medicine. We call it nutritive qi. What's the Chinese name for nutritive qi? Yeah, the gu qi, the yin qi, right? So this yin qi is the natural dampness, nourishing dampness of the Tai-Yin system. Okay? The nourishing dampness of the Tai-Yin system, that's the physiology of Tai-Yin. That's lung and spleen working together to create energy. Bringing that and breaking it down into small substances that can be in a fluid substance that can actually flow with the blood to the cells. And if I were, there are no windows here, but if I were to go to, let's say we had a glass window here, and I would approach that glass window and I would breathe on it, what would you see? Yeah, you would just see the physiological good dampness of the lungs. Okay? That's the dampness we absorb from air. So before this, always think of the climates as physiological entities before they become pathogenic. When the organs don't function well, and in fact, when the channels don't check the organ function, that's when we start having pathology. Either that or if we just overdo it, right? If I would eat a pint of vanilla ice cream now, that would be overdoing it. So nothing could help me out. Just direct hit of spleen dampness and coldness. So, and this is true for every one of the climates. Okay, we need these climates for the operational function of the organs. Okay, what does the stomach do? We're told the stomach rottens and ripens, right? So for that to rotten and ripen, we need heat. Okay, this heat is dryness. Okay, so the climate of the Yang Ming stomach and large intestine channels is dryness. So dryness is used for ripening, and also for absorption. So what's the function of the large intestine? The large intestine is supposed to absorb the rest of the fluids, creating more dryness in the intestine, so so the intestines are more solid. Okay? So these climates are constantly there. What about fire? Okay? We have two main fires in the body, the heart fire and the kidney Mingmen fire. So fire is an element which is needed. It's the heart constantly beats. Okay? It's like the most active. The heart and the brain are like the most active young chi absorbing or chi utilizing organs. And they're using this fire to keep on going. Okay? Okay. So the six chi convey the external influences of the internal into the internal environment to create this inner balance and harmony. And this inner balance and harmony is the surrounding climate atmosphere for each system that it's used to work with. We say the spleen hates what? The spleen hates. The stomach hates what? Right. Why? Because it tends to overdry because its surrounding environment is working with heat. Now the spleen hates dampness because it tends to be overdamp because that's its surrounding climatic workings. Okay, the spleen needs that. Okay. So the channels are actually the avenues or pathways of the ways these influences are actually entering the body, okay? Making this triad of this connection between heaven, earth, and man, okay? And this is very specific, okay? Each channel has an external function and an internal function. Now, the external function has to do with its relation to the outer universe, and its internal function has to do with its relation to the inner environment. So the internal function has to do with the organ, okay? The external function has to do with the climates. So basically, you can say that each channel has almost like two functions, an internal function and an external function. So the external function deals with the outer universe and the specific climate in each channel, and the internal has to do with regulating of the specific organ. So on the external function, the channels just either let the exterior come in or push the exterior climate factor outside, or just regulate it. Okay, and we'll give a clinical example in a second. Okay? And the internal function has to do with the regulation of the interior, okay, because the channels are pathways of information about what's going on at every stage with the organs, okay, and they regulate organ activity. And then they connect all the pathways. So going back to the example that I just talked about before, it was colder outside than it is in here, but still my body remained at 37, plus minus 37 degrees. And every channel has a specific affinity to a climate. So if you have a patient that comes into your clinic and they present with a scratchy throat, runny nose, they feel cold, they feel like warm tea, maybe a little bit shaking. They have fever, but it's really low, and they have this neck stiffness, okay? What would you diagnose them with? And they have a floating pulse and nothing on the tongue. What would your diagnostic be? What's that? Wind cold invasion, right? So, can you explain why they have this stiff neck? So I'm hearing blockage at the taiyang. Okay, it's a good example, but that's a good answer. But okay, what does the taiyang have to do with blockage and cold, and why is it presenting up here? So we'll come back to this example, and we'll go to another example. How cold? What's the coldest place? What's the coldest city in the UK? Okay, city with buildings that is really cold. Is London really cold in winter? No, not really, huh? All right, let's take New York, okay? So downtown Manhattan, February, New York, okay? It's minus 10 degrees Celsius out there. And in between those buildings, you also get these wind tunnel gusts, right? Everybody knows what I'm talking about. So you're walking down the street, it's really freezing. You need to catch one of those yellow cab taxis, but you can't find one. So you're just walking down the street looking for a taxi. And it's freezing, you're frozen. Has anybody been into that severe cold? Now all of a sudden you're hit with this wind gust, which is really makes it even much worse. Instinctively, you do what to avoid this wind? You actually turn your back to it, right? You don't go like this to the cold wind, okay? So instinctively we move our back to the coldness. And this is because, and this is why, going back to this example, because Taiyang channel, which travels on the back, is the channel that needs to, or it's responsible for pushing heat to the exterior, to the extremities, okay? So going back to our patient, when cold does invade into the body, we're seeing symptoms of cold congealing in the tissues, especially around the Taiyang channel, okay? So your response should be, yes, release the exterior, we know that, but the way to release the exterior is also to help the Taiyang system to bring heat to the surface, okay? And the way to help channels in general, tonify channels, is to use source points. Okay? Source points are points that actually tonify, right? Okay? Source points. So one of the best combinations you can do for an early stage wind cold is small intestine 4 and bladder 64, because these are the source points of the Taiyang. And if you add to that the lung 7 and the LI4 that you're used to doing, and the yintang for the nose, you're getting an amazing treatment that if you catch this wind cold in the first 24 hours, you can get rid of it before it even becomes an issue. Okay? Yeah, small intestine 4, bladder 64. So this emphasizes the affinity of this, the very precise affinity of these channels to different climates, okay? Say for some reason the air conditioning in this room got whacked and it started to be really cold in here, okay? So what would our physical response to that cold be if I don't have like something to put on myself? See, I would shrug us. What if it gets even colder? Like we would someone do that? Yeah, why do we do this? What's here? Which channel's up here? No, it's a triple warmer. Okay, triple warmer channel, which brings heat to the 3 warmers, right? So by doing this, your child's really cold, you do this to them, he feels warm immediately. Yeah, you may be hitting the Taiyang and the Shaoyang as well. Yeah. So bringing heat to the yang channels. Okay? So physically, physiologically, we know this. It's an instinct. Okay? And each channel has a specific climate that it relates to, opens to, regulates its function. So you can understand that a channel that operates in the environmental energy of cold is very different than a channel that operates in the environmental energy of heat, right? Meaning that there's a specific resonance of energy flow for each of these channels, okay? And the key with acupuncture, and specifically with this acupuncture technique that we're going to be talking about, is to tap into the correct, identify the correct channel, identify the correct location of the blockage, and identify the compromised area, and try to activate the whole pathway of that channel qi in order to overcome obstruction. Now, let's tackle this. So we have, in Chinese medicine, we have Jing Luo, right? Jing are the primary channels, and Luo are the collateral flow, okay? So, but if you think about it from a physiological point of view, each one of these channels is actually broken down into physiological systems by pairing, okay? So we just talked about the lung and spleen, okay? We just talked about the lung and spleen and the ability of the lung and spleen to create this energy of vital daily life qi. Okay? We talked about yang ming, the large intestine and the stomach. We just mentioned that. The stomach, what's the direction of qi flow of the yang ming? Stomach does what in terms of qi direction? It descends, right? Right. What about the large intestine? In terms of qi direction? It also descends, right? Right. And they both have to do with dryness. The stomach by heating, the large intestine by absorbing fluids. Okay? And this goes on and on. Shaoyin system, heart and kidney, okay, deals with fire. Okay? The fire of the heart, the fire of the kidneys, the Mingmen fire. Okay? So basically, the body is organized in these 6 pairs of physiologically functioning systems, okay, which we call the 6 levels or the 6 channels. Okay? But it's really important to understand that each one of these systems operate in their own distinct resonance and in their own distinct, they have their own distinct function that has to do with both the internal function of the body, but also the affinity to the external world. So in essence, we're talking about 6 channels. Okay, we just did that. So each meridian has a specific energetical quality, or channel chi wave resonance. And this wave resonance, or this, and I've been asked, do I physically think that these are energetical waves that can be measured by oscilloscope? My answer is yes. We haven't proved it yet, yes. But let's just take it literally. You'll see in a minute from the clinical example that we'll do. By operating the whole channel chi, you should be getting immediate results in terms of opening obstruction and reducing limitation. Immediate, okay? In 90% of the cases, we're looking for an immediate change within minutes from when we start doing this, because when you operate and when you catch the right wave, you can surf, right? So it's the same here. So this wave resonance beats throughout the whole pathway of the meridian, both the external and the internal. And if you tap into that wave resonance with acupuncture, you can yield a very strong, very profound qi dynamic or qi hua effect, which has significant clinical response, which you should be seeing instantly. Okay? And again, we'll demonstrate this soon, and we'll practice this after the break. So, with analogy to an old camera, when we still used to have film in the camera, okay, the organs, the picture of the outer universe is actually manifested in the organs by the shutter and the lenses of the camera. So if the film is the organs, then the shutter and the lenses, which actually determine how much light and the focus of the picture, those are the channels that actually determine what the picture will look like inside. So coming back to this is a network that has to do with transferring this information constantly, and also a pathway for moving things, both physiological entities and also pathological entities. And in essence, the basis of the concept of holism in Chinese medicine is based on channels. Okay? Everything is connected inside and also connected to the outer world, right? So it's not just a new age cliche that we're connected to the universe. Chinese medicine channel theory actually shows this to us in a very specific detail. Okay? And this. I'm going to skip this because we talked about that. So this is what we talked about before. The climate of the spleen is dampness, okay? And this is internal dampness that comes from food and comes from air to create this nutritive and protective qi, okay? We break at 11, Mark? It's 1 hour, right? Yep. Yeah, so, yeah. So just before we'll do a short demo, Actually, no, let's move to this, hold on. Yeah, so this is Dr. Wang Jui. This is back in 1999, actually. So if you want to read more about this fascinating, in-depth analysis of channel theory and practical, I highly advise you to get this book if you haven't got it already. It's a mind-blowing dissertation on channel theory. It's called Applied Channel Theory in Chinese Medicine, which was written by Dr. Wang Jui and a very, very close friend, a classmate of mine, Jason Robertson. A beautiful book, okay? Not too expensive, too. So to recap, we have channel systems as a pillar of Chinese medicine, classical Chinese medicine. We have each meridian corresponds to a specific qi. It can either draw it in, push it away, regulate its function. And the meridian system basically implants the picture of the outer universe into the internal organs. This is the foundation of the holistic view. And this climate, which is a wave resonant, it beats throughout the whole channel. You can tap into it and facilitate its function and movement. Okay, let's talk about obstruction really fast and then rush to demo. Okay, so we're told that where there's obstruction, there is pain. Okay, wherever there's blockage, there's pain. But there's more than pain, because long-term obstruction actually means that the tissue in the surrounding area of the compromised area is not nourished well, or is not nourished, and the circulation there is poor. So by establishing or reestablishing this flow, or relieving this blockage, not only reducing pain, you're actually rejuvenating the tissue in the compromised area. This is really important to understand. Acupuncture doesn't just treat pain. The way it does healing is by removing obstruction and re-allowing the tissues to be rejuvenated. Okay? Now, when you have stagnation, normally you have a certain degree, almost any injury, any old pain, or any chronic condition, but not just chronic, has a certain degree of stasis. Now, stasis or blood stasis is substance, okay? And substance is actually moved easier with moving substance rather than just moving energy. So we do energy medicine, but we also do matter, right? We ask patients to move, to do exercise, so it's not all just about emotions and energy. These are tomorrow I'll talk about the three treasures. But so it's difficult to move substance without moving substance, okay? So one of the ways that we use in this class is the Jingwell points. The Jingwell points are points that actually are used as the last points in the channels, and the points which are actually used to move blood, because they drain excess and dispel stagnation, disband obstruction, and open clumps. But they do this throughout the whole pathway of the channel. That's the interesting part. Okay? So the Jingwell point opens up stagnation throughout the whole pathway. And whenever they also activate the tendomuscular channels, making them very relevant to pain management. But they strongly move blood. Okay? Strongly move blood. And if you bleed them, then you're getting a very strong response normally. Okay? Yep. Sure. So, so in this system, this meridian wave acupuncture, what we do is the first thing we do after we assess the exact location of the channel and the pain, we actually bleed the Jingwell point to see if we're right on the right channel. And again, you're looking almost always, not always, let's say 85 to 90% of the cases, if you're right on the right channel, you're looking for some kind of change almost immediately. And it can be decreased pain. It can be pain moving to the other channel. It can be less radiation. It can be increased range of motion. It can be less numbness or tingling, anything, okay? But some reaction. So removing stagnancy by bleeding the Jingwell points is the first stage, okay? I'll show in a minute how we do the actual technique, and then again, after the break, we can practice that. And then I'll tell you about the research that we did. This acupuncture system has been used, it was the first acupuncture system to be used in the orthopedic emergency department and the hospital that I worked in, because we had very good results with the clinical trial that we did there in the orthopedic ER. so the technique is in bleeding, I'll just show that in a minute. But basically, we're bleeding the sigmoid point at the side of the channel, which is close to the condition. Okay? All right, let's take a quick look about this. Yeah, let's do the demo. Okay? Does anybody have like a very, doesn't have to be very old, but like, kind of like an old injury of, I don't know, a knee, an elbow, yeah, like an old injury of the extremities, elbows, knees, ankles, something. Over there, yeah. What's your name?
Janet.
Can you tell us a little bit about what it is?
Well, I have tears in my knee. I have, meniscal tears. I have arthritic conditions.
So is that meniscus tear actually creating, I'm going to do a couple examples, a couple people. So does that create any limitation in terms of range of motion?
It can if I'm in the clinic and I'm standing too long.
Can you, no, but right now, if you were to I don't know,
Like,
if you were to do this, can you do that?
well, I just had surgery, so I can't.
You can.
Yeah.
Actually, for post-surgery, this is excellent because post-surgery creates trauma by itself in stasis, right? So we can do that. Anyone else? We can do that. Yep, all the way.
I got old injury.
All injury in the hip. Is it an injury or is it just degeneration? Do you have it today? Do you have it now? Do you have it right now? Okay. Do you have limitation in movement? Mm-hmm. Okay. We can treat both of you either now or just after break as well. Okay. Anyone else? Yeah. What's wrong with your elbow? Okay, so we'll try to do all three. Start now, maybe finish after break. We'll do. Can you generate that pain? I'm looking for a pain that we can generate that now and we can quantify, so we can see if there's an immediate change.
If I press there, it's very sore.
How about if you hold my hand like this and turn against pressure?
Yes.
Turn that way. Yeah, is that painful?
Yes.
How painful is that on one from 1 to 10?
4.
4 from 1 to 10. So the idea is to get an exact location and to get a number, to quantify the limitation, okay? Because when I get a number, I can actually see if I'm getting any change, okay? So, what's that?
Maybe it's more than 4.
Maybe more than 4. Do you mind sitting up here so everybody can see you? Do we have, yeah, we have our swabs here. So the first thing would be to really make sure you know what channel you're on and how much pain she has. So I'm going to ask her, since I know this sounds like tennis elbow, so I'm going to ask her to squeeze my hand and try to turn the hand this way against my resistance. That should create that pain, yeah? Okay, so show me exactly where it is. So it's right here. So which channel is that? Yeah, it seems like it's large intestine. Okay, so just to see if we're making any immediate changes. Can you also, oh, you have your shoes off, okay. So later on, for you guys to practice, we have gloves here and lancet needles, and you can all pick it up, and right after lunch, we're gonna practice this, and after break, I mean. Okay, so always use gloves when you do bleeding, right? Can everybody, I'll stand here so you can see me.
Do you want my...
No, actually I'm looking for some needles as well. So you see this, we have 5 minutes to get it working, right? So let's see, right? I like deadlines. I actually only operate well under the pressure of deadlines. So can you take this thing? Yeah. Don't forget it though. Put it in your pocket so you don't forget. Okay. So bleeding is achieved by first massaging downwards on the channel, okay, towards the tip. And I'm suspecting Yang-Ming channel here. Do you ever get pain here as well?
Not recently.
Not so much. Okay. Okay, so by squeezing downwards, we're bringing more qi, and we're signaling to the body. Acupuncture is about giving, I call it suggestions. You're suggesting to the body, mind, soul system, try going this way. Okay, it's a suggestion. So if I'm indicating this direction here, and I will bleed and I will squeeze, I'm indicating a suggestion to the healing system. Try moving things this way. That's all it is, right?
I feel you've got healing hands already.
That's the placebo. You want to be really swift, and again, we'll practice this later on. I'll ask her to exhale. Can you exhale for me? Okay. And it shouldn't be painful. Was this really painful?
Yeah.
No. So I'm going to see if, yeah, it's Yang-Ming. It's difficult to get blood coming out of the Yang-Ming channel. So I'm just going to do 1, 2. Can you see the size? 3, 4, 5, 6, 7, 8. Normally you do this after a whole intake, and you understand if it's post-menstrual cycle, if he has blood deficiency, you have to take that into account, right? So I'm just going to do 8 drops because I haven't done a whole intake, and we'll see if we're getting any change. Okay, so I'm going to come back to exactly where I was standing before. Can you hold my hand again? Just tell me to squeeze, and tell me if there's any difference.
To be honest, not a lot.
Not a lot. See? She's honest. Okay. So was it 4 or a 5 before?
Well, if it's a 5 before, it's gone
5.
down to 4.
No, but it may have been a 4,
Right.
right? May have been 4. So if we get a change with bleeding, we know one thing. If we get more change with needling, we understand another thing. For example, how much of the problem had to do with stagnation of blood versus qi. So let's see that. Feel that?
Yeah.
Okay. So I'm doing Lajin System 4, and I'm going to search for a tender spot right here. Maybe here.
Yes.
Yeah. So stomach 43. Okay. And I will ask her to see if she can feel both of these nails at the same time. Can you feel the hand?
I feel the foot more than the hand.
Okay, can you feel the hand now? Let me know when you feel the hand.
Yes.
You feel the hand?
Yeah.
Do you feel the foot?
Yes.
Okay. Try to squeeze my hand again, see if there's any difference.
Yes.
How much?
2.5.
So 2.5. Okay. So we're getting
Yes.
4 to 2.5 or 5 to 2.5 within 5 minutes. That means that we're on the right channel. Okay, that's basically what it indicates. If I hadn't got any response, I'd have to scratch my head and see maybe I'm off the channel. Okay, because I'm looking for a distinct change almost immediately. Okay. Now, as the
It's better.
yeah, oh yeah.
On the burn, it's better.
Yeah, and there's a whole range of assessments that you want to do, because sometimes it's not just the pain. Sometimes it's range of motion. Sometimes it's pain during pressure. Sometimes it's pain against resistance. By the way, there's an article coming out in the JCM in October that we wrote about the system that you might want to put your hands on, because it actually describes some of the protocol of how we do this. So the October issue of JCM, we discussed this. So we have 1 minute. So basically, I would expect this pain, if we leave the needles for 20, 25 minutes, we would expect the pain to even reduce further, especially if you do a couple more of these manipulations. But let's do another one and see how we're doing. Can you feel the hand and foot?
Yes.
Both?
Yes.
Okay. Okay, press.
Yes. It's down to 2.
2. Okay, 2. Okay, so we're already at 2. This is good, right? Pretty good for 5 minutes. Okay. So after break, I'm going to leave you for a couple more minutes so you can benefit from the needles. There's more to this, right? Listen, there's a lot more that you need to do here, because we need to address underlying conditions and all that, and we'll talk about that right after break. But in general, when you do channel-based acupuncture, you're expecting to see these kind of results, okay? And for those of you who won't come after lunch, and I can't see a reason, after break, if I can't see a reason why you shouldn't, but if you decide not to and you do want to learn more, I'll be back in exactly 6 weeks to London, and we're teaching a whole weekend class. In your conference bag, you have the brochure of this system, so we'll be happy to show you. So let's come back, and when do we come back, Mark? 11:30 sharp. We're going to continue. We're going to do practice, and we're going to learn the rest of this.